And my whole sort of philosophy as a family physician was to care for the whole person, correct? So when I was in the Navy, sort of our purpose as a, medical person is to take care of the troops, take care of the sailors, Marines, et cetera, so they can go off and do their job, right? And of course, want to have to take care of the families so they can feel comfortable leaving them as they go off to do their job. And my philosophy is the same with college health. So these students are here to learn, to get life experiences and grow, and they can't do that if they're not healthy, right? So try to keep them well and healthy. And of course, if things happen, bumps in the road, we're here to support that. And so I do admit most of my time here in Ithaca has been focused on sort of the student population, but I think it's important as a physician, so I don't have that sort of connection as a physician, so I can, take care of community members, for example, right? Like my kids can't come see me as a doctor kind of thing. So I think it's important as a physician, as a Black woman, still in this community, to be able to offer support, establish trust, provide sort of evidence-based latest information about the vaccine so that people can make informed decisions. And my philosophy too is that patients are partners in their healthcare. So it's up to us, myself, and sort of partnering with my patients to kind of figure out what the best path is for them for their optimal health and wellness. So I think this is a great opportunity just to share sort of what I've learned and give people the information they need to sort of stay healthy and well during this pandemic. Yeah. Well,
I'm glad you mentioned the fact about that you operate from an evidence-based model. In that sense, I mean, it's somewhat related to the question I want to ask you now. How can we, or why should we, trust that the vaccine is safe? I mean, certainly we have the example of Tuskegee study, the infamous study from 1942 to 72 that exploited African-American men who had been treated in following the treatment of STDs and the impact on their health. So in light of that background, in light of in other sorts of dynamics that make Black and other persons of color leery sometimes of local health care, why should we trust this vaccine?
That is an excellent question. And people, you're right, people are skeptical about why should I get it? Is it really safe? It was developed so fast. And I do want to acknowledge, with the Tuskegee, sort of experiments and many countless others that have led to some distrust of the medical establishment, correct? But we don't want to lose sight that there are still systemic issues in racism and within healthcare that are still sort of barriers for people getting the healthcare they need. So we want to make sure we kind of remember what's happened in the past, but then what do we do to move forward? And I also want to say that, Black Americans, Black people are disproportionately affected by COVID, right? Yeah. They're, for example, 1.4 times as likely as whites to actually get infected. And then when we think about hospitalization rates and death rates, much higher. So we want to think about this from a preventive standpoint. For example, mammogram screening for breast cancer, colon cancer screening. So we want to think about it as sort of, how am I going to prevent from getting ill? And how do I protect my family? So with the coronavirus vaccine, it seemed like everything happened so fast. But in fact, coronavirus, which is COVID-19, is the coronavirus disease, 19, it was discovered in 2019, is part of a large family of viruses. So there's like tons of them. And people can remember maybe the SARS outbreak in 2002 or the MERS. So those are all coronaviruses. And scientists and researchers have actually been studying coronaviruses for like over 50 years. So it's not a new thing for scientists, right? And the vaccine, the mRNA vaccine, which is the type of vaccine the COVID vaccine is, these types of vaccines have actually been studied for over 10 years, including like Zika and rabies and things. So it's not like it's like a newly discovered vaccine. These have been just studied for years and years, decades even. And so just to kind of give a little bit of background, so in January 2020, so right at the start of the pandemic, when coronavirus was discovered, COVID-19 kind of sort of became in the forefront, scientists and researchers kind of went back and said, you know what, we've got some information on this virus, and with sort of new technologies and sort of new sort of progress with genomic sequencing, so studying genes and how they get sequenced out, they were actually able to get the genetic sequence of COVID-19. So it's new, but it's not like, oh my gosh, they just discovered it. They've been studying these types of viruses for many, many years. So it's kind of like something new, but not so new for the scientists, right? And I also, think it's important to remember that when we think about when the whole warp speed, getting the virus vaccine kind of, on track to quickly develop, this whole emergency use sort of determination basically takes in safety and efficacy data and just says, okay, this is something that works, it's safe, it's effective. And we think about how vaccines are usually developed. It takes a few years, but the process that kind of, propelled it to move so quickly was money, basically, right? So you get the funding, so you can enroll more patients for the study, you have more researchers who can work on it, you have new technologies that are coming in, you can all bring that in together. And in fact, there was over 44,000 people that were in the trial for Pfizer vaccine and over 30,000 for Moderna. So that's a big deal. And the vaccine, the process still goes through all the safety steps. It wasn't like there's step 1, 2, and 3. We're going to make this quick, so we're going to skip 2 and hope for the best. They still go through all the rigorous testing. And even now, there's still, I got my second vaccine a couple of weeks ago, and there's still follow-up. So there's still tracking, side effects, how you did, how you felt. So because it's so new, the vaccine itself for COVID-19, we're still learning about it. We're still going to follow patients and things. So it's not like you just get your vaccine and we don't want to hear about what may have been side effects or effects for that. So that's something that, people have to keep in mind. And to date, I think the latest CDC data was 43 million doses have been given so far. Over 130 million worldwide. So that's pretty significant. I think a lot of us think that's a big number, but it's not enough because there's still a lot of people who haven't gotten vaccinated. But I think that's just something to keep in mind. And one little tidbit to that, because it's Black History Month, there was actually an NIH scientist, and her name is Kismia. Oh my goodness, I'm gonna mess up her name. Corbett. But she is a Black woman who works at NIH, and she is on the forefront. She was on the forefront of developing the Moderna vaccine, the COVID vaccine. Yes, Kismia Corbett. Yeah. So, we are working, I'm not a scientist necessarily, but we are working to promote the health and wellness of everyone. And we have Black scientists who are, doing the job and really in the forefront of this. So I think, it's scary because it's kind of new, but there's been a lot of research for decades on coronaviruses. And to date, the safety data is very good. So I think that, that's something to be positive about.
Okay, great. Great.
Yeah.
Well, 1 in 10 Americans now have been vaccinated, so that, percentage certainly we hope will rise.
Right.
And related to that, given that distribution, what is the effectiveness of the vaccine?
So right now, the Pfizer vaccine is about 95% effective, and the Moderna about a little over 94%. So those are the two approved in the United States. I know people hear about in the news other vaccines that are out there that are trying to get that, emergency use declaration, but not so far. So we just have the 2 that are used right now in the United States. So that's pretty darn effective. That's, that's pretty darn good. Yeah. And I think, so that's another positive, I think, that people should realize it's very effective when you think about vaccinations and vaccines. And I'm sorry.
So, so what are there any side effects?
Yes, so side effects can range from sort of mild arm soreness, sort of feeling flu-like. Oh, and did we want to back up? Because I think sometimes the side effects, people may think that the side effects is because I've actually got the virus in my body. Did anybody want to like learn about or talk, just go over quickly, just the type, how the vaccine is made? Because I
You
know
can do
sometimes
that.
we think about
Sure.
vaccines and like, oh my gosh, I got the virus in my body and now I'm sick. So, which can happen too. But for the coronavirus vaccine, it's what we kind of alluded to earlier, is an mRNA vaccine. So it's messenger RNA. And basically what happens is a little strand of RNA is put is packaged up in a little casing, and that casing makes it easy for the piece of RNA to get into the cell. And it's not the whole COVID virus RNA, it's not like the actual virus itself, but what happens is you think about this little mRNA strand as like instructions for the cell to sort of make a protein that kind of looks like coronavirus, but not really coronavirus. So what happens is this little packet with the RNA inside goes into the cell. The cell reads it as, okay, I'm going to make this protein, see what's, to kind of display on the outside of the cell. The other thing is this little messenger RNA does not affect the DNA of our cells. It doesn't enter like the nucleus. It doesn't control our cells. And actually, once this protein is displayed, the cell just takes care of it. It just gets degraded and it's out of your body. So you got this little piece of sort of foreign protein on the cell, and your body's like, well, what the heck is this? We're not sure if it should be here, what's going on. So your immune system starts to kick in to develop antibodies, so that if at some point in the near future, you may need this antibody for a real infection, then your body's already primed and ready to go, so that your antibodies have developed. So in 6 months, you have an exposure to, for example, COVID-19, your body's already ready to go and with your antibodies to fight off the infection. So that's sort of where that technology with the mRNA comes in, where it's not a live virus. So you can't get sick, you can't get COVID from it, but it's kind of a template. You kind of fool the body into thinking it's coronavirus, but it's really not. But your body thinks of it and builds up all these antibodies and say, I think that's what it is. And then it's not, but now you're protected. So that's sort of how, I would think about it. But so side effects, pain. So we talked about pain in the arm because you're going to get a shot in your arm. So that's definitely going to be uncomfortable. Sometimes you get some swelling, a little bit of redness, but not an infection at the site of the shot. Some people do experience fever, feeling sort of tired, headachy. Sometimes you feel like you've got chills and body aches. Usually most side effects occur within the first 1 to 2 to 3 days, and they resolve after a few days. Studies have shown, and these are kind of the sort of the local symptoms are kind of like the arm swelling or pain.
Sure.
About 80 to 89% of people will have at least one of those types of local symptoms. And then about a little bit bigger range, 55 to 80% of people may develop kind of the feverish feeling, the body aches, the chills. And again, those are short duration types of symptoms. In fact, one of my colleagues, he got a second dose of the Moderna vaccine and we did fine, had no real side effects with the first one, had the second one. The next day, he just felt like, oh my gosh, I felt like I was so achy and stuff. But by the next day he was at work and it was fine. And I had a little arm soreness after my second dose. But other than that, and then people think about allergic reactions and things like that. And it's interesting that neither Moderna or the Pfizer vaccine have any egg, latex products, preservatives. They have the little encasing thing that helps to take the RNA strand in, has what's called PEG, which is a common ingredient in like laxatives and some chemotherapy drugs and things that, when you get a colonoscopy and you need to get cleaned out, that's the same stuff. So if you have like an allergy or reaction to that in the past, that may be something to think about as far as alerting your doctor or the person giving the vaccine. But so those are the main side effects. And again, they're short-lived. And it's not because you have coronavirus after the vaccine. It's just the reaction as your immune system is spewing up to kind of make those antibodies.
Where the body is responding.
Exactly. Yes,
Gotcha.
Exactly.
Gotcha.
Yeah, so I think that's good to know, and I think that's reassuring for a lot of people. Yeah, like
one of the things that has come up, among some in the public, in particular people of color, that they're being bullied into getting the vaccine. That Black doctors are being tokenized to promote it. How would you respond to these assertions?
So I think this is two-pronged. I think we got the bullying piece, I'll talk about that, and then the tokenization of Black healthcare professionals, I guess, the other thing. So the bullying piece, I think, let's see, what I can do is go back to the data. So African Americans are disproportionately infected with COVID. They are going to be, they are sicker, tend to be hospitalized more, and have higher death rate. And the comorbidities, but there's also some other, systemic issues going on where you think about healthcare access, the type of job you have. Like if you're like a frontline worker and you can't work remotely and you're working with the public, yeah, you're going to have a higher exposure risk, right? So there's a lot of other factors. Housing, maybe you share a house with your parents and your kids, and so that you have those more of a close quarters kind of situation. There's a lot of other factors that can play into that. So yes, and the comorbidities, if I have diabetes or some, other chronic medical condition, I'm a little bit more prone to have more of a serious outcome if I get infected with COVID. So I don't see it, I see it as protecting you, right? Okay. Because so if we have something that helps either prevent the disease, prevent infection from even developing, or even if I do get COVID and I got vaccinated, because data is still out as far as how long immunity lasts, even after the vaccine, or even after I already had COVID. So that's another thing that they're still studying. But why would I not want some, I would think to optimize my health with something safe, effective, that can keep me out of the ICU or the hospital or, 6 feet under. And so I think of it as just educating the public. I mean, I'm not, there's a lot of people who have various opinions about vaccines. COVID-19 is not the first and it won't be the last. But I think that people should be armed with information, and then they can make their determination. And as far as sort of this tokenization, I have a little mixed feeling about that. So in my role at Cornell, we often, and it's because, there's not a lot of Black doctors, but when students see us, they're going to they reach out to us to say, hey, can you give a talk on X, or give a talk on how this affects, Black students. I mean, there was a couple, for a few years, I've been doing this talk to an African-American fraternity group about mental health in Black men. So I don't feel tokenized. I feel like there's they feel a trust that it's easy for me to be approached, and that I can provide that information that's helpful for them. So my role too, in sort of within the community is I feel sort of an obligation in a way, due to my position. I mean, we think about privilege and things. I think from my perspective, if I have time and if I get invited to speak and just sort of promote what is the best practices, what is recommendations, with any community, but I enjoy, I feel honored when, people of color, communities of color say, hey, you're a Black doctor, can you talk about, X, Y, and Z to our group of teens or something? I think that's great. Yes, I would love to do that. So I don't feel tokenized. I get there is tokenization in many fields and many areas. I totally get that. But if I thought that was the case, I wouldn't be here. So, but I think it's just about sort of sharing information and building trust and building community. And I would want the same if, for my dad who's down in Georgia, who doesn't even, that's a whole other nightmare down there with COVID. But as far as educating the population and just providing that support and resource, but so so that's my 2 cents on that.
Okay. And I wanted thank you. I wanted to backpedal to a question I really meant to ask you before the question you just answered.
All right.
Why are the side effects worse with the second shot?
That is a good question. I do not have the answer to that. I think that is probably what some of the, and I think maybe your immune system from the first shot has already been primed, so it's even more primed with the second shot. I think that's part of it. And that's my guesstimate. I don't have a, scientific CDC answer for you, but that is part of the ongoing studies about side effects and what people are feeling after they get the vaccine. Right. So some people do really well. Some people like, oh my God, I felt like I was hit by a truck and I couldn't move the next day. Yeah. And it's a 2 dose. So we definitely recommend you get both don't feel like, I got the first one, I'm okay not to get the second one, but it's
Mhm.
at least these two, the Pfizer and the Moderna vaccines, are designed to work most effectively in 2 doses. Yes, I think this Johnson & Johnson has a 1 single dose version out there. It's not been approved yet, but so more to come on that. Yeah, but I think it's more of a priming of your immunity. Just kind of feel like it's a little bit stronger the second dose.
Okay,
Yeah.
great.
Yeah.
One of our audience, one member of our audience asked if this COVID-19 affects African Americans at a greater rate, is there any information about the efficacy of the vaccine on African Americans?
So from my understanding, when they did the studies, the clinical trials, it included a mix of, patients from all demographics. So when you average out the effectiveness, it's going to be as effective for a Black person and a white person. So there's nothing genetically that's different between a Black person and a white person that's going to, change my response to an immunization. With COVID, it's more of a, how should I say, it's more of a social determinants of health kind of issue, right? So if certain members of a community are from a certain ethnicity or, race, you can interchange if you want, have more propensity for diabetes or for chronic heart disease, then yes, you're going to be more effective just because of that health issue. If you're in a community where, there's limited healthcare access, you're going to get sicker because if you can't just, walk down the street to get to your doctor's office and you've got to take, who knows how many, depending on what's going on, or you have a lack of trust, or you don't have a primary care doc, or you have some insurance issues where you don't even have access because you don't have insurance. Yes, that's going to be an issue and a barrier for getting good care. And then my job, if I have a job that I'm with the public all day, but I can't, work remotely and I'm an essential worker, then my boss is not going to give me, time at home so I can work, but I can't work because of, because of the COVID pandemic. So there's a lot of people in that situation. Healthcare workers, we can't not do our job. Right. So there's a lot of things that are put in place that can be improved on, but it's not, so the vaccines is going to work just as effectively regardless of race, because race is a social construct. It's not a biologic thing, right? So that's
exactly.
Yeah. So the effects of COVID on Black Americans is because of a lot of social issues too, and not being able to quarantine if you need to, or not go to work, etc. So those are the things, or chronic conditions, which many other populations can have similar issues. So yeah.
Okay. Now, there are those who have heard that the vaccine causes death. Is this true?
No, that is not true. From the latest CDC sort of studies, the COVID vaccine does not cause death. There may have been some anecdotal sort of like, I got the vaccine and then someone died. There could have been some other things going on, but out of the, there's millions and millions of vaccines that have been provided, there has not been a death because they got the vaccine, if that makes sense, that makes sense, yes. But again, they're still doing ongoing studies, but yeah, but so far, fingers crossed that. And of course, there's been the reports of the severe allergic reactions and things, and those are still very rare. And we also sort of forget that they can happen with other vaccines, but now COVID-19 the vaccine is the forefront. But just be aware that it's an ongoing kind of, they're still studying that. I think the last set of numbers I saw, maybe with the Pfizer, was it 1 per million? I don't know, like an allergic reaction. So it's very low. But if somebody knows that so there's some things that we can do as medical professionals to sort of, mitigate those things, you'll have like things on hand if you have an allergic reaction. People, even after the vaccine, you're actually being monitored for at least, for like 30 minutes to check to see how I did. So, yeah.
There's another question that's sort of floating around, in which, people will say, well, there are a lot of
floating around. Yes.
And the question goes like this: I don't understand if I can still be a carrier of the virus and pass it on to others. Once vaccinated, can I carry the virus without knowing it? Because I would have no symptoms, asymptotic. Can I
Oh,
then pass it on to others, and how would I know?
so, and this is like a vaccine related question, correct?
Yes.
Okay, so the good news is that there's no live virus in the COVID vaccine. So you're not carrying the virus in your body. You're not going to be able to pass it on to anybody else or have it and you don't know you have it. So that's the beauty of this, right? So the way vaccine works, it's just using the little template of the little RNA, messenger RNA to direct the cells to like put something on the cell to say, yes, this is COVID, but it's COVID-like, but it's not really COVID. So, and your body develops the immunity to that. So yeah, you do not have the COVID virus from the COVID vaccine.
Okay.
So that's something that should, alleviate some of the concerns regarding that.
Okay. And another inquiry is, if I get the vaccine, can I stop wearing a mask?
So the latest, the latest guidelines from
You know the answer.
CDC. You showed it. We all know the answer to that one. Because again, we don't know how long, even with the vaccine, how long immunity lasts. So we don't want to assume that just because I got the vaccine that I'm good to go and go to my, parties and not mask. So the recommendations are still the same because this is still an ongoing study. So we're still expected to mask, physical social distancing, that's 6 feet, avoid large crowds, good hand washing. Yeah, unfortunately, it's still going to be a while before we can say no masks ever again. Yeah.
Now, what about the variants of the vaccine? I mean, there are at least 4 variants out there that that hail from London, I believe, from South Africa and 2 other places. How effective is the vaccine against the variants?
Right. So that's an excellent question. So currently, yes, there's the UK version. There's the South African version, and there's the Brazil so far from maybe the next one. Okay. Yeah, Brazil. So currently we have seen most in the United States, and definitely in New York State, the UK version. They are still studying because, this is a new variant, right? It's mutated since the vaccine was created, which happens a lot in viruses. As the spread continues, there's more chance for things to mutate and change, and then you get new version. So far, we're still not sure if this current vaccine will work against all the variants, but so far, at least, there may be some effectiveness. Again, this is still ongoing studies, and who's to say in 6 months, there's another, 3 variations. So we just have to be patient but they're they're recommending the vaccine regardless of, the variants and stuff. And in fact, just a little side note, because Cornell, does we do our testing here and things, but they're able through the what's called the PCR test that's how we detect COVID, COVID-19 for our students and staff. We're actually able to detect which variant it is, at least the UK version. Yes, wow. Yes. So they're tracking that. So we are tracking that, and it's being tracked. So we'll see, what happens. Unfortunately, it seems like some of the variants are a little bit more infectious, so they spread easier. Yeah, which is kind of not great for us. Yeah. So there's some things to keep in mind. Again, so masking, distancing if we can, washing our hands. Regardless, it was going to be helpful because those variants, we don't know how, in the future, if the vaccine's going to be enough. Yeah.
Or how virulent they'll be,
exactly.
Potential for that, as Dr. Fauci said last week, but we don't know yet.
We don't know yet. And that's the problem. I mean, the more it spreads, the more it can change. And we'd like to stop the spread if possible.
Yeah, it can mutate into something.
Exactly, the mutation, exactly. Yep.
So how does the vaccine help us with community immunity or herd immunity?
Right. So that's a great question. So the herd or community immunity means a certain section of your population is already immune to the infection or the disease. And that's either through I already had the disease or I got vaccinated from the disease. So, and what that does is help prevent against person-to-person spread. So the virus has no place to go. So hopefully you see almost a zero incidence of the virus. The challenge for us, because COVID-19 is still relatively new, we're still studying how many people in a population need to get vaccinated before we achieve that herd or community immunity. So we're not sure, we don't know, but it does help. I mean, immunizations are a great way to achieve that, to sort of help with that. I mean, and granted, people who have had COVID-19, there's still some debate and study about that, but currently recommending that you still get the virus. You have to wait maybe days, some time after you've actually had your infection, but it's still recommended. So herd immunity is, is achieved by either vaccinating or already getting the disease. And because of COVID-19, we'd rather have people vaccinated than get the illness, because we don't, want to get sick, get hospitalized or die. So I think that's, probably preferable. Yeah. But that's a great question. Yeah. Now
I have more of a COVID as opposed to vaccine question.
Oh, just kidding. Sorry.
Well, I'm hoping you can speak to it.
Yeah.
I don't know unless I asked. So.
No, you don't. Yes. Of course. Go ahead and ask.
So, can a person with underlying conditions be asymptomatic?
Absolutely. Yes. Like if they contracted COVID, can they be without symptoms? Even if they had, absolutely. Yes. Yes. Yeah, that's kind of the tricky part of COVID, right? COVID-19 is that people can spread and not know they have it because they don't have symptoms. They feel fine.
Yeah.
I mean, of course, you're most infectious when you do have symptoms, but that's sort of the challenge with this.
And even if they have underlying conditions.
So if I have diabetes and I get COVID-19, I may have a more severe case, perhaps, or perhaps not, but I can still get infected and not display symptoms.
Okay.
Yeah.
Okay.
At least maybe initially. Yeah.
What if you get the vaccine and it doesn't, and there aren't any side effects? Is it still working? Is it still effective?
Absolutely. Yes. So when you get vaccinated, I mean, you'll be the lucky one if you don't get side effects from the vaccine. But it is still effective even if you don't get side effects. It's just like medications, right? I take medications for example, for my blood pressure. I may not get the side effects like the, cough or lightheadedness, but my blood pressure is still controlled. It's sort of a similar kind of concept.
Okay. Okay. Can you talk about the Johnson & Johnson vaccine? If that's the only one available for example, should I get it? If it's, right now reports are that it's 72% effective. Should I accept the less effective version than say Moderna or the other, Pfizer?
So that's a good question. And I honestly, I have not really really looked into the Johnson & Johnson vaccine yet because it really is not being used widely. So Moderna and Pfizer are the only two that are available. And I think, and then that's the thing. So that's an interesting question when you talk about resources and who makes policies about what vaccine is going to be distributed to where. So I think, if I was a policymaker or someone in a high place, yes, you want your population to have the most effective vaccine. I mean, and I don't know if there's some more studies that need to be done with Johnson & Johnson as far as effectiveness, because yes, you want what's going to be optimal for you and to keep you healthy and safe from coronavirus. But so that would be kind of I'd be speculating. I'd be very surprised if if that vaccine would be the only one available. I can't even imagine that would be the case. I hope that's not the case because we do have the most effective, the Pfizer and Moderna available in this area for those who are in that stage, at least for now. Yeah, that's a good question.
Okay. So in the context of, this sort of anti-vax sort of, I guess you could say movement of sorts, or maybe a better choice of words. I'm still afraid to get the vaccine. I may or may not subscribe to the anti-vax philosophy.
Right.
But I'm afraid to get it. can I just wait for this to be over, let it pass, and and if I'm lucky, I don't get it? What would be the
Yeah.
risk?
Well, I think a couple of things. So one would be, we don't know when this is going to end. I mean, I wish I could. I mean, I have two kids in college who are both home remotely because they can't go back to campus. We were hoping. And I'm hoping they can get back in the fall.
Mm-hmm.
So we don't know how long this pandemic is going to last. So, waiting it out. So you think about waiting it out and maybe getting sick with COVID and being hospitalized, or taking a vaccine that's safe and effective to prevent you from even perhaps getting sick with COVID and getting hospitalized. So I think, that's an individual choice, of course. So you kind of have to arm yourself with all the information, kind of, weigh the pros and cons. But I think getting COVID versus being protected from COVID, you have to kind of answer that yourself. But I wouldn't just wait it out, because we honestly don't know how long this is going to last. And as new, variants come around, do we have to shift the vaccines a little bit? How long is that going to be? Yeah, I think this is going to be here to stay for a while. So I'm not sure waiting it out. I couldn't say for sure how long that would be, and then risking perhaps getting sick with COVID.
Sure.
That's definitely it could be a hard decision, but it's an individual one. And I would encourage people to, chat with your healthcare provider or your doctor, just to kind of talk about the pros and cons. But waiting it out, I don't know. If I could say next week, sure, but I can't. I'm not so confident it's going to be a short time.
Yeah.
So
will getting the vaccine increase my chances of contracting COVID in the future, or make me more sensitive to it?
So when you get the vaccine, it's not going to make it easier for you to contract COVID or be infected with COVID. It's going to do the opposite, because your body has built up immunity or antibodies to actually fight off the infection or even prevent you from getting infected with COVID. And it's not going to make, in the sensitive part, what was that last part about sensitive?
My chance would I be more sensitive to, I guess, or susceptible to getting COVID? Oh,
no. So it's the complete opposite, because your body's built up immunity and antibodies. So you're actually much less susceptible, actually. Okay. That's the whole idea. Yes.
Okay.
Yes.
Okay. Do you suspect flu cases are down because of mask wearing, symptom screening, and regular sanitation practices? Are these things we should continue to do?
Absolutely. Yes, the mask wearing, frequent hand washing, staying away from people who are sick. Those are things that definitely helped us see less flu this year. I totally agree. Yeah. I just, yeah. That's actually what we've seen here, at least sort of in our environment. And who, what do you know? Hand washing and not being around people sick and wearing masks and avoiding keeps from spreading viruses, right?
Sure.
Keeps you healthy. So,
okay,
yes.
Great. So now I think we're going to open up lines for the audience to speak and raise any questions or make any comments they would like to make.
Yeah, so if anyone would like to make a comment or speak, you can just raise your hand. That way I'll see that you want to say something. We do have a caller who is in on the phone, so I will just temporarily open up your phone line for you to talk if you want. If you don't want to say anything, just hold tight and I'll turn it off. Opening the opportunity for our phone-in caller, just in case.
Oh, I see. Okay.
May need to unmute himself or herself.
Oh, yeah, they are on mute. Yeah.
Just give you a second. It's totally fine if you have no desire to speak.
Yeah, that's okay.
Okay, I'll close that line now.
Okay.
Anyone else would like to speak up, please feel free to raise your hand. Oh, my daughter is here with a question. Hold on.
Oh, okay.
Just 1 minute. She does not have a question about the vaccine, I guess.
You sure? You
She
sure?
does. She does. Okay. What's your question? You can ask Dr. Hamilton.
Yes, ask me anything.
What do you think about the shot? What's your question?
She's like, well, never mind. Never mind. I don't really have a question.
All right.
We'll ask you
Well,
afterwards.
I do not see any questions coming in through the Q&A or, and I do not see any hand raised. So I will just leave it to you, Dr. Hamilton, if you have any last statements you would like to make about the vaccine, any last comments to share, and then I'll wrap it up for us.
Yeah, I just wanted to sort of summarize, just saying that it's been, coronaviruses have been studied for a long time. And this vaccine technology has been studied for over 10 years. So the process that's brought us here today has been safe, primarily, safety, efficacy is top of sort of getting that emergency use authorization, and it has proved to be effective and safe against coronavirus. There's still ongoing studies. We're, studying side effects profiles and things, and of course monitoring the whole sort of changes and new strains. But I think that it is a great way to prevent significant illness and mortality, dying from coronavirus, COVID-19. And I just encourage everyone, if you have questions, you want to talk with your doctors or healthcare providers, go on the CDC website. I know Tompkins County has a lot of good information. And just I want everybody to be informed and just be able to make those decisions for themselves. And hopefully we'll be able to keep our community nice and healthy and safe for months and years to come. Thank you. I think this was fun. I was so nervous.
Yeah.
I was like, oh, it's fine.
No,
We're good.
no, we're very appreciative, Dr. Hamilton, for your, really excellent
Thank you.
responses and
Thank you.
and
I hope
helping.
yeah. Oh, I'm sorry. I didn't mean to.
Oh, that's okay. No, really helping to expand our scope and address some, very real and concerning questions that people have.
Sure. Absolutely. And it's important to get those addressed and then hopefully eliminate some of the, things that may be a little bit, that need to be clarified. And I think that makes that makes it easier to make those informed decisions.
No,
Right.
Absolutely.
Mm-hmm.
We have to be armed with facts and evidence as we go.
Exactly.
Yeah, I would just echo those kudos to you, Dr. Hamilton and Dr. Clark. Thank you
Yeah.
both for joining
you,
us
guys.
today, for
Absolutely.
supporting this event.
Thank you.
Please follow the Tompkins County Health Department for updates on all those questions about distribution and,
Yeah.
when will it be my turn? Please be patient. We will all get our opportunity to get this vaccine. Continue to do what you're doing, wear your masks, keep your distance,
Yes.
reduce gatherings, hand wash, and just, stay safe, stay healthy. There will be additional Q&A opportunities. If a question comes to you and you're like, I want to talk to someone a little bit more, feel free to join us for another session. Those registration links are all on the Tompkins County Health Department website. And you can also go there to sign up for those alerts that I had mentioned earlier in our discussion. Thank you, Dr. Clark, for moderating, and thank you, Dr. Hamilton, for all of your important information.
Thank you.
Thank you.
Well,
All right. Have a good one, everybody.
Okay, you
thank
too.
you.
Thanks. Go get lunch.